Here we are going to discuss some question and answer for NCLEX board exam. This question and answer is collected from previous year, and we want nobody left behind. So the first question is here. Before understanding a subtotal thyroidectomy, a client received potassium iodide and also PTU, means profile thiouracil. The nurse should expect the client should to subside. So if a patient have a thyroid problem, hyperthyroidism, that time we need to thyroid glands to remove. It is called thyroidectomy. So after thyroidectomy, patient need the medication, particularly profile thiouracil. So profile thiouracil take time to start works. So how long take time to start work? Number one, in a few days. Number two, 3 to 4 months. Number three, immediately. And number four, 1 to 2 weeks. What are the correct answer? It takes 1 to 2 weeks. The rationale, potassium iodide reduce the vascularity of the thyroid glands and used to prepare the gland for surgery. Potassium iodide reach its maximum effect in 1 to 2 weeks, and PTU, means profile thiouracil, blocks the conversion of thyroxine to triiodothyronine, we call T3, the more biologically active thyroid hormone. And profile thiouracil, shortly called PTU, effects are also seen in 1 to 2 weeks. To review the symptoms of hyperthyroidism in term, the client are usually given beta-adrenergic blocker such as propranolol. So when you started the patient PTU or potassium iodide, it is important educate them, tell them it takes time to start work. Next question. When giving intramuscular injection, the nurse should insert the needle into the muscle at the angle of 15 degree, 13 degrees, 45 degrees, 90 degrees. Correct answer is 19 degrees. Rationale, when giving intramuscular injection, the nurse insert the needle into the muscle at a 90-degree angle and using a quick or a 15-degree angle appropriate when admin intradermal injection. 30-degree angle is not used for any type of injection. The nurse may use 45 or 90 degrees angle when giving subcutaneous injection. In this picture helps to get clear ideas. So 90 degree intramuscular. So the needle and body surface area or muscle 90 degree angle here. 45 degree subcutaneous, like insulin, heparin, intravenous 25 degrees. And intradermal, it is less than 10 to 15 degrees, right? Next question. A client with pancreatitis is admitted to the medical intensive care unit. Which nursing intervention is the most appropriate? Number one, provide generous serving at mealtime, or reserving antecubital site for peripherally inserted central line catheter, shortly called PICA, also providing the client with plenty of PO fluid, oral, limited IV fluid intake according to the physician order. So correct answer is reserving an antecubital site for peripherally inserted central catheter. The rationale: pancreatitis treatment typically involve resting GI tract. Inflammation of the pancreas, we call pancreatitis. It is good to give them rest, right? So give them rest means not to eat, sir. If patient do not eat, how will maintain the nutrition? We go for IV, either central line or PICA line. The nurse should reserve the antecubital site for PICA, which enable the client to receive long-term total parental nutrition. By this, we can prevent the imbalance of electrolyte. The client in the acute stage of pancreatitis also require large volume of IV fluids to compensate of the fluid loss. Next question. A nurse is teaching a client with osteomalacia how to take the ordered vitamin D supplement. Which adverse effect should the nurse instruct the client to report? So if patient has osteomalacia, osteoporosis, it is good to give them vitamin D. But if patient take vitamin D too much, it produces adverse effect. So it is important to educate my patient what are the signs, symptoms of vitamin D. Number one, GI upset and metallic taste. Number two, dry skin, hair loss, inflamed mucous membrane. Number C, flushing and orthostatic hypotension, sensory neuropathic, or difficulty maintaining the balance. The correct answer is GI upset and metallic taste. The rationale: the nurse should instruct the client to report GI upset and metallic taste because these are early sign and symptom of vitamin D toxicity. Such toxicity also may cause headache, weakness, and renal insufficiency, or renal calculi, hypertension, arrhythmias, or muscle pain, even conjunctivitis. Dry skin, hair loss, or inflamed mucous membrane suggest vitamin E toxicity. If the question come here, vitamin D supplement, we choose number GI upset. But if question comes vitamin A toxicity, we could choose number 2, because vitamin A toxicity are dry skin, hair loss, inflamed mucous membrane. Flushing or orthostatic hypotension, it is the effect of vasodilatation, maybe result of nitric oxide or nicotinamide supplement, or any anti-hypertensive medication can cause hypostatic hypotension, particularly GTN, nitroglycerin, which also used to correct the niacin deficiency. Sensory neuropathy, the last one, and difficulty maintain the balance suggests the pyridoxine toxicity. The next question: which commonly administered psychiatric medication is prescribed in individualized doses according to the blood level of the drugs. Number one, clozapine, alprazolam, lithium toxicity, and clonazepam. So individual dose according to the blood level. So which drugs has a narrow therapeutic index? We need to check. Definitely correct answer is lithium, clozapine, alprazolam, or clonazepam. This number 2 and number 4 is tranquilizer, anti-anxiety medication. That does not cause this kind of toxicity as like a lithium. Lithium is a mood stabilizer. Rational doses for lithium and anti-manic drugs. Mood stabilizer we use for bipolar for the manic states. Usually are individualized to achieve a maintenance blood level 0.6 to 1.2 milliequivalent per liter. Although clozapine use require monitoring of white blood cell count, and clonazepam use require monitoring complete blood count and liver function test. These tests are not used to individualized doses of the drugs. Alprazolam dose does not based on blood level of the drugs. Next question, a physician order ampicillin 500 milligram by mouth every 6 hours. This medication order is an example of a standing order, a single order, and as needed order, a state order. Correct answer is a standing order. So definitely this question, if you read, you can 500 milligram by mouth every 6 hours, right? So it is not a single order. And if the doctor prescribed 500 milligram as needed, but it is not mentioning in this question. And state dose, you just give once. You do not need to recap it or repeat it. A standing order apply until the prescriber writes another order to alter or discontinue the first one. Many healthcare provider or healthcare facilities have established policies how long order for certain classes of drugs, such as opioid or antibiotics, are to remain the valid. A single order allow a one-time dose only. An as needed order allow a nurse to admit the drugs whenever the client needs. A state order includes such word as now, immediate, or start. A nurse is teaching a client who will soon be discharged with a prescription for warfarin, which is standard, which statement should the nurse include in discharge teaching. So if your patient under prescription of warfarin anticoagulant, it is important to educate them about the precursor for anticoagulant. Number one, eat more yogurt or broccoli. These drugs will dissolve any clot you may still have. Number three, if you miss a dose, double the next dose. Number four, do not take aspirin while you are taking warfarin. Correct answer is do not take the aspirin while you are taking the warfarin. So number one, eat more yogurt or broccoli does not related to the warfarin. Only vitamin K containing medication like deep green leafy vegetables, or if you miss a dose, double the next dose is not justifiable. The rationale is because aspirin decrease the platelet aggregation and interfere with clotting, or concomitant use of aspirin with warfarin. An anticoagulant may lead to excessive anticoagulant effects and also can cause the bleeding. Warfarin therapy is the most effective with consistent dietary intake of vitamin K. Increased intake of foods rich in vitamin K, such as broccoli, could change the client warfarin dose as requirements. Although warfarin interrupt the normal clotting cycle, it does not dissolve the clot that have already formed. The client should take warfarin accurately as ordered to maintain the desired level of anticoagulant. Double dose could cause the bleeding. Next question here. A client with atopic dermatitis is ordered a potent topical corticosteroid to be converted with an occlusive dressing. To address a potential client problem associated with this treatment, the nurse formulates the nursing diagnosis of risk for injury. To complete the nursing diagnosis statement, the nurse should add which related to the face. Number one, related to potential interaction between the topical corticosteroid and other oral drugs. Related to vasodilator effect of the topical corticosteroid. Related to percutaneous absorption of topical corticosteroid. Related to topical corticosteroid application to the face, neck, and also interrogier's site. The correct answer is related to percutaneous absorption of topical corticosteroid. Rationale: a potent topical corticosteroid may increase the client risk for injury because it may be absorbed percutaneously and causing the same adverse effect as systemic corticosteroid. A topical corticosteroid are not involved in a significant drug interaction, and this preparation causes vasoconstriction. Next question here. A post-operative client is receiving heparin after developing thrombophlebitis. The nurse monitors the client carefully for bleeding and other adverse effects of heparin. If the client starts to exhibit the sign of excessive bleeding, the nurse should expect to maintain antidote in a specific to heparin. Which agents fit this description? Phytonadione, it is the chemical name of vitamin K, protamine sulfate, corabin, plasma protein fraction. So correct answer is protamine sulfate. Protamine sulfate is an antidote specific to heparin. But vitamin K is the antidote of warfarin. Is the antidote of specific oral anticoagulants such as warfarin. Thrombin is a hemostatic agent used to control local bleeding. Plasma protein fraction, a blood derivative, supply colloid to the blood and expand the plasma volume if patient need. And it is used to treat the client who are under the shock. Next question, a nurse is caring for a client in a dystonia crisis. Which medication order should the nurse? Questions. Potassium chloride, normal saline, hydrocortisone, fluorocortisone. Correct answer is potassium chloride. Rationale, the nurse should question on in order for potassium chloride because a dystonia crisis result in hyperkalemia. Admitting potassium chloride is contraindicated because the client is hyponatremic or in order for normal saline solution is appropriate. Hydrocortisone or fluorocortisone are used to replace deficiency of adrenal cortex hormone. And next question is here, because the cervical effacement and dilatation are not progressing in a client in labor, the physician order IV administration of oxytocin, other name is called pitone. Why must the nurse monitor the client fluid intake and output closely during the oxytocin administration? Number one, oxytocin causes water intoxication. Oxytocin causes excessive thirsty. Oxytocin is toxic to the kidney. Oxytocin has a diuretic effect. Correct answer is oxytocin causes water intoxication. What are the rationale? The nurse should monitor fluid intake and output because prolonged oxytocin infusion may cause severe water intoxication. That is lead to the seizure, lead to the coma, even death. Excessive thirsty result from work of labor and limited oral fluid intake, not to the oxytocin. Oxytocin has no nephrotoxic effect or diuretic effect. In fact, it produces antidiuretic effect. So from this question, we learn oxytocin can cause water intoxication.